Hi, I'm State Rep Patty Bellock, and I want to thank you for the opportunity to address the issue. Senator Ryder and I have been working on the Medicaid issue for about the last 4 or 5 years, so we're pretty passionate about it. And we were honored to serve on the working group with the governor and with Julie Hamos. So we have been working passionately, I would say, for about the last 10 to 12 weeks, and we would still like to look forward to working some more on the group because the governor asked us directly to come up with $2.7 billion in cuts. And we agree with him that this program needs to be sustained. We need to protect the integrity of the program, and the program is out of control. The program is designed to meet the needs of the most fragile population in Illinois, like the governor said. And we are taking this opportunity right now to look at that system, such as other states are, New York, Tennessee, all around the country. They're all doing the same thing, and we are too. And we think that the programs that we addressed in the reform are good. We don't agree with all of them, as it's hard to get agreement upon everybody, but that's why we look forward to working further in this, in achieving the $2.7 billion in cuts, and at the same time reforming. We set aside last year the Medicaid reform bill. We had 8 major reforms in there that we wanted to see implemented last year. Actually, 4 of those had been in law a year before that. We have not seen that yet. Those again are in this reform, but we feel that if we can get all of those reforms done and continue on a few major ones that we'll like to address right now, that we can get to the $2.7 billion without increasing a tax on somebody. We feel that in the last year we have already had $6 to $7 billion increase in tax on the people of Illinois. We look forward to working on this program because this is a $15 billion program, $11.5 billion of which the taxpayers of Illinois are paying for right now. They're asking us for accountability in that program. They want to see the people served that need to be served, but they also want the system to be reformed. They know that there's not a good eligibility accountability here. They need to have reforms in how the system is accessed by people. They know there's waste and fraud in the system, and we need to address that now, and we have the opportunity. If we have a couple more weeks to work on this, we think we can get to the $2.7 billion and actually have a better system, a reformed system, a redesigned system, and a system that is actually going to be more accountable to the taxpayers of Illinois.
Good afternoon. I'm Senator Dale Ryder. Representative Bellock, thank you for joining me here, and we welcome the opportunity to talk a little bit about what the governor had to say today about his plan. Let's rewind a little bit to the start of the session where the governor stood up before a joint session of the General Assembly and said, we have to reduce the Medicaid program in Illinois by $2.7 billion. The governor's right when he made that statement. If we don't reduce the program by $2.7 billion, we will do what the governor and his predecessor and their legislative allies have done year after year after year in this building, which is kick bills off into the future, push bills off into the future. That's part of our problem, a big part of our problem in our Medicaid system. Now, the governor has surrendered to his own announced goal. His plan that you see here today does not reduce the Medicaid program by $2.7 billion. In fact, half of his program relies on a tax increase that will simply be used to fuel more spending and a near $700 million cut to Medicaid providers like hospitals and nursing homes who already suffer from some of the lowest rates and the longest payment delays in the entire nation. And what's so ironic and sad about that is that if you cut rates by near the measure of what the governor's talking about, fewer providers, fewer hospitals, fewer nursing homes, fewer doctors, fewer pharmacists will take part in the Medicaid program. The fewer providers there are, the less access there is for health care for the very populations that the governor says he's the most concerned about. Now, I appreciated the governor's words that he thought that the working group had done its best and that he was going forward. The working group's not done. This is not the working group's plan, this is the governor's plan. And we don't view the goal, as the governor said, of $2.7 billion in reductions as a goal. It's a mandate. This is what you have to do to save the program for the people in the state who need it the most. And so we're ready to go back to work beginning Tuesday to continue to find ways not to add new taxes, not to cut underpaid providers even more like what the governor's suggesting, but to reduce the size of the program that is already too big for our taxpayers and our constituents to pay for.